If you are a woman between the age of 21 and 65, you should get screened for cervical cancer. Cervical cancer occurs most often in women over the age of 30. In Delaware, women are being diagnosed with cervical cancer between the ages of 40 and 64, in some cases at advanced stages because they were not getting screened. Cervical cancer can be prevented by getting regular cervical cancer screenings called Pap tests. A Pap test is performed in your healthcare provider's office. For the test, you will lie down on an exam room table and place your feet in supports called stirrups. The provider will insert an instrument into your vagina to access your cervix and obtain a small number of cells which will be sent for examination. A Pap test can tell if you have abnormal cells on your cervix that could become cancer. Speak with your healthcare provider about the screenings that are right for you, since recommendations can vary. In general, women ages 21 to 29 should have a Pap test every 3 years. Women ages 30 to 65 should have a Pap test and an HPV test every 5 years. When you reach age 65, your healthcare provider will tell you if you should continue your Pap tests. Certain women are at higher risk. You should be screened more often if you have an HIV infection, have had an organ transplant, have been exposed to the drug known as DES, a synthetic form of estrogen. If you have had your uterus and cervix removed in a hysterectomy and have no history of cervical cancer or precancer, you should not be screened. If you can't afford a Pap test, Screening for Life can pay the cost of the test for you. Talk to your healthcare provider today or visit healthydelaware.org to get more facts and to get help scheduling a Pap test.